Now we have the latest on the H1N1 flu. All 50 states have now ordered the vaccinations, and nearly 2.4 million doses are now available. Children are the first ones in line, as you know, to get immunized, but some parents are saying no and are worried the shots are not safe. So moments ago, to get some answers, I talked with Health and Human Services Secretary Kathleen Sebelius. Secretary Sebelius, thank you very much for joining us this morning. There is a new poll out this morning that shows that the majority of Americans are reluctant or unsure about getting the H1N1 vaccine for themselves or for their children. So what do you say to them, especially parents, to convince them that the vaccine is indeed safe?
Well, Robin, this vaccine is being made exactly the same way seasonal flu vaccine has been made year in and year out. So while this is a new virus, and the great news is we have the right vaccine for this virus, we also have years of clinical data on seasonal flu vaccine and a great safety record.
Secretary Sebelius, it's not just, though, parents concerned about the vaccine. We are hearing from a number of doctors concerned about giving the vaccine. So how do you convince them?
Well, again, we're doing everything we can to reach out to providers. We've done a lot with OBGYNs because we know that pregnant women are particular targets. And, you know, when I was pregnant, I was very reluctant to take anything, certainly to try anything new. I didn't want to do anything to harm my baby, but what we've been told over and over again by the scientists, and that's what we want people to do, look at what we know from the science of the vaccination, is that the risk for pregnant women is much higher getting the flu than getting the vaccine. And in fact, the only way pregnant women can protect themselves and their babies once the baby is born is by getting vaccinated.
When can we see it nationwide?
Well, it's the early shipments have started as of Monday, and there is some vaccine in St. Louis yesterday. They were receiving their first doses. We're going to continue to push it out as fast as it comes off the production line. Our target date always to begin vaccine distribution was October 15th, so we're a bit ahead of the curve. That's good, but limited amounts so far are being available. As soon as it comes off the lines, we're going to get it to our state and local partners.
We have, of course, reported the tragic deaths among those across the country, including some teenagers, but we are also seeing that the vast majority of people are reporting mild symptoms. So if that is indeed the case, why get vaccinated?
Well, I think I hear that all the time, Robin. You know, this is just the flu. Just the flu kills people. It puts people in the hospital. We know that they're going to be, we now have over 600 deaths reported. So taking the chance that you or your roommate or your child may be one of those maybe rare but serious cases, may have an underlying impact, may expose someone else.
Secretary Sebelius, thank you very much for your time this morning.
Sure. Great to talk to you.
All right. Have a good day.
Thanks. You too.